No, so.
No, normally she emails.
So we are recording now.
Yeah.
Good morning. My name is Harrison Pierce. I'm the Chair of Health and Human Services Commission. Thank you for attending. It's good that we have brought back and we have commission members to travel. Good morning, Tom Ferguson is not here. He's in Switzerland. I'm not sure he'll be zooming in, but whatever. And Alicia, hopefully your kids get better quickly. She's sparing us all the contagion element.
Thank
you, Dr. Pierce.
Let's see, first item on the agenda is approval of the May 4th minutes. Questions, comments?
It sounded like you had a great speaker. Was it on Zoom or talking about the Connecticut, you guys remember? No.
Western Connecticut.
Yes.
Sainsbury.
Right.
Community Action Agency of Western.
Yeah, that
Connecticut.
sounded very interesting. Not going
She was
on.
great.
She was great.
Yeah, we've gotten information from all of our speakers. It's good to-
Oh, absolutely, yeah,
I
sorry.
I would like to make a motion to approve the minutes.
Yes, I just have
Oh, sorry.
one or two comments.
Sure.
One, the domestic violence crisis center luncheon was phenomenal. The speaker, Tanya Savartman, whatever, she's an amazing woman. She was so articulate and multi-talented. In fact, I was listening to her speak and the English and the grammar were so good. I had a flashback to My Fair Lady way back when. Plus, Hagen's telling us something about Eliza, whatever her name was. Sure, her English is too good. She must be foreign. Yes.
Yeah.
Anyway, it was an amazing. And successful, and Jackie was acknowledged and Dee Bartlett introduced her and spoke about her. Jackie's mom was, so those involved positive experience. And
Yeah.
the speaker did write a book, Assume Nothing. And so it was, I bought a copy, I haven't read it, but you know, it's an amazing history, and she was a victim of domestic violence.
Very public.
Okay, so moved.
That make a motion for us work with the commission to approve the minutes as written.
Second, and
All in favor? Aye. Okay, reports, Jen Isleson.
Jen Isleson, Director of Health. So we continue to offer COVID vaccination. And it's for, just as a reminder, the bivalent is for 65 and over, or if you are immune compromised. And it's been 4 months since your last dose. The monovalent vaccines are no longer authorized or approved. So only the bivalent is available, and it's expected in the fall. There'll be a new formula with the new updates for Omicron, like they update the flu shot every year, basically. And then they'll release whatever the guidelines will be at that time.
You have that bivalent in inventory.
Cases have been pretty low and non-existent, unlike last May where we had, record numbers, so that's a nice sigh of relief. As a reminder, the federal declared emergency ended on May 11th. So, but basically that means there's no more FEMA money, but things like vaccines and stuff are still going on.
Can I just ask a quick question? Do you have to pay for vaccines now, or are they still?
Not yet, it's still free, so who knows when it's. Could change if it changes, because there's also CDC money for, like the Vaccine for Children program, where we get all the vaccines for free, so it depends. We'll see what happens in the fall. Right now, we're in the middle of relicensing all the salons and doing all the inspections for that. Those are due by June 30th. All the pools have been done and completed, all the relicensing's in and all the inspections were done. Most of them opened for Memorial Day. There's just 2 pools at the Y that are out of commission that haven't submitted, so whenever those pools are done, we'll just have to inspect and get the licensing, from them then. The building permits and septic are still up. I did want to point out the ticks. We had a record number of ticks submitted in May. 51 that were submitted, 7 of which were positive for the bacteria that causes Lyme. So as part of that, and in conjunction with the Lapham Center, the health department, Shannon is going to be doing an educational free seminar called Tick Talk, One Bite Could Change Your Life, Protect Yourself from Tick-Borne Illnesses, along with Dr. Roskowski. And that's gonna be at Lapham on June 6th at 1 p.m. We already have 70 people show up, that's great, which is like pretty unheard of. So I'm sure there'll be more by then, but it's a topic that's, you know, right now, because of the amount of ticks, because it wasn't cold enough this winter, it was too mild, they haven't died off, and in fact, it's the opposite. And people are being much more diligent about doing tick checks when they come back in, so it's great. And again, we submit it all to the state agricultural station, and it's, you know, free submission. So that program hopefully will be good, and we're looking to do more with Lapham, like a different topic every, you know, maybe month or so, and what's the topic of the time, or what you need to. The Matter of Balance class is still continuing. There's 2 different classes we're doing there. And again, that's the age group from 80 to 96. And that's been very well received by the seniors. So we're gonna look to continue that with Aggie, and once she starts planning her summer month of where we fit in with her. ELC 2, I got the approval for 1 and 2, the grant reports from the state. So I submitted 3 and 4, and that's a total of $30,813.33 for reimbursement. So that's moving along nicely. And then just lastly, the charts again, not much is changing on suicidal ideation, and are still the biggest group is the 10 to 17-year-olds. So that continues to be something that's concerning, that should stay at the forefront of, you know, what everybody's looking into. And as a reminder too, the state today ends COVID reporting from June 1st until the fall, sometime in October. So,
What are you gonna do with all your free time?
yeah.
Which other island?
Should come to Michigan.
Spartan.
Lots of ticks though.
Questions, anyone, comments?
One, Dr. Wiskowski, he and Seth Sullivan are just 2 internists that have joined the Canadian Medical Group over the past year.
Oh,
And Shannon did want someone, a medical person, to assist with her. She'll be presenting this. To take her. Yeah, the parade. So were you invited, or? I mean,
no, the health department was not asked to participate this year in any capacity. Or in the last couple of years, we were leading.
Yeah, I know when COVID was.
Yeah.
In the headlines.
No, now we're forgotten about. COVID. Yeah. You're done.
Watching the parade and all the different factions that constitute it. I mean, Health and Human Services and what you do is such a major part of your canon that, you know, I think should be represented. I know that you've never really participated with that, and yeah, Marcy, I'm crazy about giving up Monday on the weekend, but the reality is just have people aware of it too. It is a little marketing thing. I'm standing next to this fellow who's 3 generations and they're active in town, especially. They're a very athletic family, and one of his grandson's actually captain of the North Carolina lacrosse team. Now he's going to Northwestern as a receiver, who's a very prominent football player in Canada. But he's saying that he was most so appreciative of Vine Cottage #1 and with the immunizations. He said, I didn't even know they existed. So, things like that, and no matter what we do, there's a segment of society that's unaware.
Mhm.
So, I mean, just having it, and the board that marches. Health and Human Services.
Well, and I think, the more, these programs we do, hopefully, the more, we remind people that we're not just here in a crisis when we need it. Our inspections that we do every day of the restaurants and salons are to prevent, illnesses, and our intern Anders got to see that and said the same thing. He had no idea what we do behind the scenes, because public health, if you're doing it correctly, you're not having, these outbreaks and issues, so.
Well, maybe,
Unfortunately, it takes a worldwide pandemic for people to.
well, but maybe like when you're doing your program for the ticks, that's a great audience.
Yeah.
Maybe you should start at the beginning and give a little, here's what we do. Before you introduce the speakers, just an overview, this is what your health department
I have
does.
a question on, once you have identified that the tick has bitten you with Lyme, what's the protocol?
Every doctor is
If you're
different.
out of the sick, then you get a test.
Yeah.
Put it in a retreats, but I'm not done that.
Protocol is the
I would get a shot of penicillin or.
swab for symptoms. Because so you had 50-something ticks and,
Yeah, then it
6% were positive or roughly.
if there's 51, 7 positive, so it would also depend, how long was it on you, is it engorged, whatever, and every doctor's a little different depending on what your medical,
Yeah, they say it has to, the tick has to be embedded for 20, 36, maybe 48 hours. A little variable. But it's not only the Borrelia, the Lyme disease, there are other tick-related diseases.
And they test for all of them, so they'll tell you if it's positive for like anaplasmosis, it'll tell you what it's positive.
I think the peer education would be helpful, because most people think that they don't have anything to worry about unless they get the bullseye.
Yeah,
And whatever, and they think I just had a tick and they don't, so I think some education, I think would be helpful, that you can still have it tested, and for those of us that know individuals that have suffered from Lyme disease over many, many years, it's can be debilitating.
Chronic Lyme disease is problematic.
Yeah,
especially in our nice wooded areas that we all like to go to.
The most important thing is to be vigilant, but sometimes you have had Lyme twice, and once it was behind my knee, and my wife said, "What's that?" And just parts of the body, you don't see the big red brown rash. And so, vigilance is important.
Sounds good.
But clearly there's an anticipated audience, so we were kind of shocked at how many already have signed up.
Are you
But
gonna
that's
tape
great.
it? Are you gonna videotape it? Might see that.
I don't know if,
on channel
Lapham
79.
really has that. capacity over there. But I can see if maybe IT can do something.
You could record your Zoom, have it on.
Bring the owl.
Be good to have.
No,
And then I get like the post, yeah, and put on, I'm sure channel 79. Just we're trying to get awareness,
absolutely.
Anything else, Jen? Or-
No.
Thank you. Human Services, Bethany Zell.
Hi, Bethany Zarro, Director of Human Services. Starting out with the items that we are doing and tackling. I've spoken with Tiger and the ADA town compliance report that will be coming out, I don't know in how long, but talk to him in terms of having him as well as the consultant who's doing the final work to come and speak at some point when they're ready to. I think it would be good for the commission from an ADA perspective, and maybe there'll be some type of recommendation on your part. The May meetings, I just wanted to give you an overview, meeting, some more than once, others it's just on a monthly basis. But the most frequent meetings this month were the Family Assistance Center planning with Russ Kimes in the Office of Emergency Management. And we're really starting to get together with CERT, Voices of 9/11, and the community clergy, Interfaith Council, to start getting Lapham Center set up and the planning itself. So the layout of where each department would be amongst the Assistance Center. This would not be a public place. This is only for those families in the event of a mass casualty that needed to go and find the status of their loved one. So obviously the police already have, once we get this done, then the police will receive this and they will have a huge security plan done based on what the parameters are here. And everyone's just been great with the partnering and the interest in making sure.
I think I missed, but this is an emergency.
Management, yeah.
So when an emergency happened, then they would all be already organized and everybody goes at Lapland.
Yeah, and just the key players, the community clergy, Russ and I had lunch with them, and what we want to do is we want to make sure that we are culturally competent. So that we're coming in there, anybody who comes in there, that we do have an aspect of a culture, of a religion base, faith base, and maybe having that the clergy or laymen in the clergy, I mean, in their faith-based community to come. We just want the more comforting, the better. And so we want to be very competent or know whom to contact in the event that we do have some type of cultural competency that we feel we're lacking in. Should come.
No, I think, correct me if I'm wrong, was it the YMCA, we installed a generator there for housing during an
So
emergency or fallout?
That's what Russ is working on.
Okay.
There's an MOU going, he's working with the Y. I am not involved in that center. I
Okay,
think that's more sheltering.
right,
And so I am just working on the Family Assistance Center right now.
got it.
But when that gets finalized, yes, then they'll bring in.
Yeah, the Family Assistance Center is more for mass casualty kind of event, like a mass shooting or
A fire.
something that goes on and then, you know, the family needs a place to gather and where to direct them to services. There's a regional plan for this already
Yeah.
through the regional health departments. And then each individual town is responsible.
Does the Lapham have a generator backup as well?
They have a
They
generator.
have a generator, okay,
Yeah, and this is open. This is not a 24/7 thing.
understand.
This is whatever the hours would be, 7:30 to 3:30, but whatever, and DPH, so, you know, Jen has more stuff can you do? So,
Another opportunity.
so Russ is leading this. I'm part of the assistance center, but everything goes back to Jen, so she knows what's going on.
A question on the Ukrainians. I was amazed to find out there are 400 Ukrainian students in Stanford in the system.
Yeah, there's a large population there.
Right.
They do have a faith-based, yeah. Some are here too. Yeah. Yeah, I'm taking care of them, the faith-based communities, they know who Human Services is working with them, and we're giving them the resources they need. So, yeah, we're there. So the number two, the Get About board, we meet on a monthly basis. They're just thriving. They had an unbelievable last month when they had their fundraiser. It's just a great board and very, very lucky that they joined the town in terms of decreasing their costs. I'm in the process of doing the fiscal year grant for the state transportation for disability and older seniors, and so that's going well. We usually get about 26 to 28,000, which is great, and then we are passing the $48,000. This all helps towards keeping this wonderful agency that just gives back to the community. Telehealth, we're going to discuss that on the agenda. New Canaan Urgent Assessment Program, Steering Committee. We are in the process, you can see on the next page, I did an update for the assessment program at the end of the notes. And there is the PowerPoint, which you can click on your computer to get, it's basically the same information that I have written down, it's in the PowerPoint as well, so however you'd like to see it. Darien had an unbelievable suicide awareness walk. The turnout was incredible. So looking at that and talking to the human services director there, I'm in touch with the school, Silver Hill, possibly something next year to get a suicide awareness walk going. There are a couple of groups at the high school with the kids in crisis, teen talk counselor, the mental health group, things like that. I think this would be a great idea. So we're starting to fish in terms of what we can do there.
Or maybe you can use that walk as a fundraiser for the program itself.
It depends who's sponsoring it.
Could you,
Yeah.
just elaborate on the suicide walk? What did they do?
So they had a trail, a path that they did a suicide walk. It was just for awareness. I don't know what happened at the end, if there was a talk afterwards. Maybe this could be in conjunction.
But this was marketed by the town, and this was happening, or was it
The-
Health and Human Services? Or what?
No, human service, the school.
Who did it?
It had a really great program involved with the sports, where each sport had a game dedicated to suicide awareness, but even at a lot of Darien home games, they had a campaign called It's Okay to Not Be Okay.
Alright, so
the
this is what-
awareness
yeah.
that Speaking, they really, I don't know who it is, but it seems like the school.
Yeah, so I started
Have
getting,
gotten involved in really trying to
yeah,
address, obviously they had, this horrible year with the two suicides, really not let that just sort of fall by the wayside.
yeah. So I thought this was something that we can sort, but
Yeah.
everyone's busy right now with school
Yeah.
ending. But I do, they said in the summer.
When
they
is the
have to
next
talk to-
major parade that we have here?
Just Memorial.
Veterans Day, well,
Veterans Day.
We do. There's now.
They do a quick memorial over at the.
Yeah, that's a really good. It would be really great if that spread over to us. I felt
I
like
know.
every time I was at a game there thinking that's so amazing and.
Yeah, so I'm gonna try to,
Beforehand,
this is something that,
captains would speak, before the game and sort of shout it out. Like, it was very cool.
Yeah.
community oriented.
so I
A
think
lot
we
of
should do
students
something,
loved it.
Sure.
partner with the school board of ed,
Yeah.
other community, the hub. I mean, there's some
Kids and.
Teen Kids in Crisis.
Yeah.
family centers as a whole, yeah. So I'm gonna learn more about what happened and
Mhm.
and get this pulled together, hopefully. The New Canaan Abuse Prevention meeting, and obviously, Harrison discussed the DVCC luncheon, so all that is continuing. Women empowering women, the Institute, which is based in New Canaan, they're really starting out and they're nailing it in terms of the programs that they're offering. And right now, the primary programs are for those with children with special needs, the parents dealing with that, as well as empowering women who are going through some type of transition in life. There's, domestic violence, low self-esteem, and so the courses that they're offering, and they're just right on in terms of what's needed. So we've been referring a lot of people. Right now, their classes are only for New Canaan, because of the awareness they're just building. And their improving self-esteem program, it's full, and it's all New Canaan women. So yeah, there are 17, 20 people that are coming to this class. And so they're working on, in terms of funds that are needed, the support of the town. It's something that we are, as human services, really utilizing. And people are,
How long have they been in existence?
I think, a year, 2 years.
Right, that's the one who used to run Concordia Music.
Yes, Arts for Healing.
Yeah.
Karen Kieserman,
Yeah, Karen, yeah.
yeah, and Robert, yeah, so we definitely are working with them. We possibly might see some type of grant award application for next year. For
Your referrals have been that category, special need, women transitioning.
Yeah.
EV.
Yeah, exactly. And then I completed the grief practitioner licensure. So I did this so that because of the Family Assistance Center planning, I just want to make sure that, understanding grief, loss, and being able to say the appropriate things as well as understand the possibilities of what might be happening. We're working now, Marcy and I, in terms of starting in the fall, a grief support program at Lample. On a bi-weekly, we're trying to figure out, we have to talk to Aggie, whether we want it every other week, once a month. But Marcy and I, she has her grief certification, and so we're gonna get going on that. I'm done with the bloodborne pathogen training for the year. The last one was with the lifeguards that are coming in for the summer at the Waveney Pool and Kiwanis. I've had, a few referrals this month covering the gambit, and what else? Been doing grief counseling. I spoke at the New Canaan Inn regarding New Canaan emergency planning. Russ was unable to make it, so. I went and we had about 20.
Not this, Russ.
No,
Yeah.
Yeah.
They said, oh, they thought it was Russ Kimes Senior. But anyway, we had a wonderful get together. I'm hoping to do more at the end. And it was a great, I don't know, 20, 25 people there. And they had no idea what, like Jen said, what happens behind the scenes for emergency preparedness. From the Family Assistance Center to setting up the OEC and just everything. So they were it was reassuring to them. And blood pressure clinics continue, food pantry, we've had an uptick. You can read Marcy and Jackie's case management. It's ongoing. Yesterday, we had 3 more with EMS, police, and adult protective services. Marcy is going out to homes, sometimes with the police, sometimes with the adult protective service caseworker from the state. It's not just one phone call or one visit. Sometimes visits will be an hour, hour and a half. A psychiatrist, when the state comes out, she has to be there. There has to be somebody else there, and very complicated, but we are getting the things done. Sometimes it all works and the person does get the help they need and want. Other times it's against advice. People feel as if they are capable of making decisions, and sometimes we have to get state conservatorship done because they aren't, and they're a danger to themselves because of exploitation. We have a couple financial exploitations going on where actually the banks call us. And then we get the police involved. So it's just there are a lot of pieces in each puzzle, and sometimes we feel as if, great, this worked, and other times it's their free will. And we do have to let them carry on. But very interesting. And then also we found the New Canaan Urgent Assessment Program. You can see the numbers, total cases since July, 111. The age ranges, once again, to verify, to agree with Jen and to prove that 26% children and under, 29% going into this program, doing an assessment between ages 13 to 17. So having the steering committee meeting, we're going to get a little more into depth with these numbers. Silver Hill said they agreed to, because we're trying to figure out in terms of when it says primary complaints, this is at the time of assessment. This is not diagnosis. This is complaints. And so substance use, is it abuse or is it use? Sometimes, medical, there's marijuana that's legal now. So fine tuning it a little more and maybe comparing it to if there's a diagnosis or potential diagnosis, what people come in with. We do feel like substance use at 5% is very low, but this is what they're presenting. It's not what they're.
Yeah, their point is that no one wants to acknowledge that, or very few do.
Yeah, other things do come up.
After time, it comes out. that this
Yeah.
is, maybe the court should.
Yeah.
Subsidiary.
And as we said, Weston, in terms of the funding sources for next year, we have the town of Weston has given a grant to Silver Hill. So they will have the Weston urgent assessment program. And we're, going for a couple more towns.
Does that count toward your 250 goal, the money that?
Yes.
Yes.
Yeah, and that has not been signed yet. They haven't given that number yet. Silver Hill Hospital Community Benefit Fund. That they have not decided what's going to put in. I think we're waiting in terms of the New Canaan Community Foundation, the Mental Health Awareness Fund, that they are doing a matching.
Right, they had a lot of success with the luncheon, I heard.
Yeah, a lot of
Couldn't do
success.
that, right.
And then there are 3 families that are doing a match challenge and things like that. So Lauren said they haven't met their goal yet of 500,000. I could be wrong, don't quote me.
It's 500.
Thank you, that's right. Thank you, Peter. But they are getting close. The numbers are coming in, so Lauren was pleased with the numbers, but that, will be given out at a later time. So that is it in my realm. Any questions?
Sorry.
Yeah,
Now, the number that New Canaan Community Foundation will give is TBD, right?
Yeah.
Weston, do we know what they're doing?
do you know, I'm going to give you an assumption. Weston's population is about 10,000, so it's half of what ours is. And I think it was requested 150,000 for them to come in. From discussions, I think it's around 75. I'm not sure though, because that is between Silver Hill and Weston. And I don't know what's been signed, but it's definitely happening.
They're out now.
They're not out completely. The mental health director that the Board of Ed hired. She's getting, Susanna Lewis from Silver Hill spoke with her, and she's got the lay of the land now in terms of what the town needs and what they have and things. So talks are not over. In fact, they might be beginning in terms of areas where the urgent assessment program could fill a disparity. So
I think some of the, from my
Yeah,
understanding, and I had dinner
Okay.
with Andrew last week, there's still discussions going back and forth. I guess their hope is during the summer, when things are not as busy, they get the time. CHAP is still out there, still marketing itself as a very low cost navigator, if you will. It's just a number that you call in, they help navigate services. So they're trying to compete against that, I think,
Yeah,
from a
that's it.
marketing standpoint, which
apples to oranges at the
It
same
is.
time. So Weston is part of the, was it Positive Growth or
yeah. I think it's.
Positive Directions, yes. So they bought in, Westport has Positive Directions. And so Weston is paid part of the cost, which is, I don't know, 15,000 a
It's
year.
a very small number.
Yeah.
So is CHAP is a very small number to have that.
And so-
navigator system, so.
That Weston has had 4 or 5 people that have utilized.
Yeah.
And, but there was a greater need of mental health care needed. So that's why, they are interested in the Weston Urgent Assessment Program. It needs to be brought to another level.
Right.
So it's wonderful. We are going to work on getting 1 or 2 more towns,
Yeah.
small towns.
Interestingly.
Yeah.
Dr. Gerber spoke at the foundation meeting yesterday. And April and May, they were at about capacity, like around 19.
19, yeah.
For the 2 months, so, the marketing issues and the word is kind of getting out, and in fact. It's, if that would continue, every month, they're at capacity.
They're at capacity, so
So the problem that we've been worried about, Harrison, for a long time. At least based on those 2 months, it sounds like word is out and it's getting utilized at the level that everybody had wanted, and it may require
yeah,
new thinking if it continues.
which is great. In the geographic distribution, New Canaan, of the 111 cases, 82% have been New Canaan. So it definitely, the word is getting out.
So is that the sole reason, Peter, that Dr. Gerber thinks the numbers are higher in April, May, or?
They're just watching the numbers in 2 months in a row, and I think there'll be a drop in the summer. which
In the summer,
always
yeah.
happens, but the feeling is that.
Yeah.
Recommendations are out, there's more awareness, and it's kind of achieving its kind of volume objectives, but it does raise.
Yeah,
Different
it's
challenges going
challenges.
forward, like, you know.
so,
We're
yeah,
hopeful though that you'll see the suicidal ideations, those start to drop off, those that are appearing in the emergency department in the hospital, so. But yeah, I agree with you, I mean, that, you know, if you think about April, May, at the end of the school year, where college I go to, the stretches of, you know, my life and things of that nature in the summer. I wouldn't have expected that to be extraordinarily high as would
but then,
you, I think, and especially here around the holidays, you're going to expect that, but ongoing finance and funding, I think we all agree, as it's mentioned, is extremely important. And whether it's the Mechanic Community Foundation, or we find other ways through, you know, a walk or a fundraiser to work with the Board of Ed. I just think we need to bring more players to the table to help us.
yeah,
Yeah,
like the town
fundraise.
players, so they did a fundraiser with their play and they.
17,000.
18,000.
Yeah.
That is just so appreciative and useful, going towards an unbelievable cause.
Just a number check. So 19 per month or 19 for the 2 months?
19 cases in May.
Both months, they were around that.
Yeah, I think there were 17
And
in
so that's
April.
impressive. So that's getting to where we're, well, versus Monday to Friday and Saturday,
Yeah.
something, one per day when you get to that. It's good that is self-sustaining. I mean, granted, they're
Right, and
freebie for some of it until the.
And my thought is if towns, and the towns start coming in, maybe we cannot take, maybe we can only do New Canaan and Weston, who's ever paying in, because look at, I mean. Others, things like that, I hate to turn them away, but. Do we have a say?
No, but that's not the goal.
No, it's not the goal, but it's gonna raise the price, but this is
They
what
have
we,
to increase the personnel.
exactly,
That's available, that's Silver Hill.
And the costs of it, too.
Success builds success.
yeah,
And if there's a need out there and they're going, that's.
And that was the
Yeah.
discussion. Yesterday, we were pressing on that, hey, all of a sudden, there's a different set of challenges, but what I will say is there's so much. Awareness
Yeah.
amongst, you know, the town, certainly the foundation and other groups. There's robust, really robust support. Now, to figure out exactly where the money comes from is still, there's still work to do, and the
Yeah.
foundation is very favorably disposed, they're trying to figure out.
and how much?
Well,
Increase
there's
another
different
level,
Players.
Yeah, the marketing is, it's been impressive to get these numbers.
yeah,
I mean, and Andrew going out and speaking
Wonders.
is.
and he will continue to do so, he said. The other interesting thing was when we were talking about, well, they might see a decrease during the summer, but then.
You got
some-
vacation time for the therapist, you got. you know.
Yeah, but someone at Silver Hill mentioned, well, kids come home from college and parents know, so they might see an uptick in terms of a different age group.
That's older than 24.
Yeah, so they said, they don't know. So they're definitely, Silver Hill did a great job in starting out slowly and being able to pace this, while still keeping the quality. But yeah,
And his commitment is super impressive to Kane, and he's doing a world of good beyond just this program. He's speaking everywhere, and you guys know he's a great speaker. But we should definitely acknowledge that as a commission of thanks of the time and everything else that they're putting in, him and Susanna too.
yeah.
Yeah.
Yeah, there's a whole team there, Jules and Brent, and he was we said, well, maybe this will become the Silver Hill Urgent Assessment Program with other towns, and he said, absolutely not. My goal is to have Silver Hill in the community. So this is not their program in terms of owning it, it's a partnership. So it was very, he definitely wants these programs to have the town's names. Because Silver Hill is in the community, and he's definitely stressed that through the years, and it's,
Well, it's that balance, it's the balance of being effective and being timely and being.
Yeah.
you can get to them right away with, you have enough critical mass that financially it makes sense, and we don't have to keep, raising $500,000 every year to get to some point where.
Yeah. The sustainability, so anyway, all good. For all good reasons.
How do we label this going forward in Canaan Weston?
So right now, Silver Hill said it will be New Canaan Urgent Assessment Program in New Canaan, and it's the Weston Urgent Assessment Program in Weston.
That's good.
And, but as they do their marketing, they have their own marketing meetings and things like that, they will give us input at the steering committee levels.
And they're making assumptions about utilization from the two towns. And I think the contribution from us will be in line with that.
Yeah.
And if that change, those the numbers change, they'll probably change the, so it actually, from what I heard, seems a pretty fair approach.
Yeah,
And then sort of depending with Westport, I would think that if it's a positive relationship with Weston, then
so that's our next meeting, yeah. Susanna, yeah, New Canaan, Weston, Human Services Director, and a couple people from Silver Hill are going to meet with Westport.
The growth has to be smart though, because we don't
Yeah.
want to get to a point where they're overwhelmed and we started for New Canaan, and New Canaan children are not getting in for 48 hours and it gets prolonged. So I think those quality measures are extremely important that we keep track of.
And right, and that's what they are very serious about, maintaining, they're working on in terms of their goals. And I have heard, from people that we have referred them to, that getting the appointment within 48 hours, fantastic. The assessment itself with the professionals, fantastic. It is the gentle handoff in terms of finding the next person and everybody getting back to everybody. The report being written, things like that. They want to streamline that more, maintaining the effectiveness and the professionalism. But something's gotta be tweaked there. And that's the feedback that I've been getting.
Data collection too.
Yeah.
They're actually really trying to mine the data, especially like the symptoms
Yeah,
thing
yeah,
that's a real
Yeah.
challenge.
but they see it, they're gonna work on it, and it's just a great team.
to Russ's point, on their side, up in Silver Hill, we'd like them to expand as the need demands, but the fact is that getting psychiatrists, getting clinical social workers, getting nurses, getting PAs, we all know that you ought to know many plans.
Exactly, yeah.
That could be the limiting factor on that end.
Okay, let's see. Thank you.
Deputy too, by the way, Deputy's been a huge part of this.
Yeah.
In terms of the creation of the whole thing, it's all out, we keep.
Looks good.
Hey, I'm a firm believer in it, so
Thank you, Bethany.
thank you.
Whole business, commissioner activity, Meals on Wheels Barb.
Oh, yeah, well,
You did something with the list.
listen, we did Meals on Wheels, which everybody should do, because it takes an hour and you get to go, really get into some homes, and, I mean, not getting. You get to see- But where I went, which I'd never been to, was Canaan Parish, which is phenomenal.
Beautiful.
It's so beautiful, and there's a guy there named Bob who meets you there, and he's a resident, and he takes you and shows you where to drop off the 2 meals, but it was great to see, and it was just great to have some interaction there, and you can see that some of their fathers are trying to do different. So I signed up for 2 more times in July, so if anybody wants to, I'll send the dates, but I feel like we can, we can get people to go.
Did you say it's online signing up?
Yeah, it's kind of genius. The thing is, it's like full very quickly because Star, the program,
Yeah.
kids with special needs, they do it every, and then also Get About does Schoolhouse. So they're just 2 shifts and they're really easy to do also. So I'm just trying to sign up with you in advance and then I'll publish it. You guys can come, it'd be great, but it's easy. It's a really good way to get a little sense of one of the populations.
So we should deal with you for.
Yeah, no, I'll send you the dates because I just have 2. I mean, if anybody wants to. It's July 10th and July 25th, so it's a little bit in advance, but I had to kind of book in advance, so.
How far out do they go in terms of
They go like 3 months out, but
Okay.
it fills up pretty quick, so, but if people are interested, I'll get some more dates, you know.
There's some
just-
great volunteers that are.
Oh, yeah, and Waveney does an amazing job. with
Yeah.
food. The food smells good in your car, you're like, oh. Well, you know, it's pretty much.
By the way,
Lunchtime, I ended up with one extra meal.
You beat that up. Lois.
No, I think to give somebody their meal, so I called and Mrs. Willis is like, oh, yeah, you know, they mentioned somebody got an extra meal, and I wish I had known that, 'cause I retraced my steps and.
And Meals on Wheels is great in terms of human services. They'll contact us if a volunteer says, you know, I put the food in the refrigerator and
Yes.
she's not eating.
It's moldy, yeah, right.
And
is.
there was a concern about the apartment looked very disheveled. She was very confused, you know, so then we can do our outreach.
And the-
They'll
and
get
the-
in touch
and the-
with me.
Yeah,
Yeah, it's a
it's
great,
wonderful, like from a privacy standpoint, it'll say, so-and-so does not want you knocking on the door, there's the coolers, the coolers, or somebody else wants to say hi, and they're very respectful, I think, of how people, you know, appreciate
Yeah.
the programs. And you can see there's people on and off, short-term, long-term, it's just a huge, great resource.
yeah,
We know that
another
from
great
there.
resource, yeah.
Yeah. The only thing, as long as we're doing community, just quickly, I saw your number of households using the food pantry is up. Is there an opportunity there? Do you need volunteers? It might be, again, it might be a one-off thing for one of us to do.
Yeah, I would love to do that. That's just
Yeah, so-
we're involved in multiple rules, but I'd love to do the food.
So
pantry.
the distribution, the next one is June sixth. What if I have Enza, who runs the food pantry? She'll include you on the
Okay.
volunteer email.
That would be great.
Yes, that'd be great.
Yeah, I think everybody
Yes,
just wants.
that's a great reminder.
Yeah, it's
Yeah.
like a couple hours, you know, it's not.
And what things can we bring, and it'd be nice to know what things they stock there, so if we want to bring things with us to donate. that would
So-
be great too.
On the New Canaan Human Services website, if you click on the food pantry, the calendar is there, as well as we always have the current things we're low in.
Got it.
Or low on. And so if that changes. So if you want to
Okay.
look at that, when you're going to be going,
Sure.
but the food pantry drop off is 24/7.
Just leave it right in.
So if you can't volunteer the day of or night of distribution and no children are allowed just because of public schools and families coming in to get their food and we just want to keep the confidentiality. So just
Got
yeah, sometimes the moms want to bring their kids in to show, but they can't. Yeah,
it's canned food and it's dried, it's all packaged.
all
Okay.
non-perishable. Yeah, so anything, if you're cleaning out your cupboard,
Well, I mean,
Or
even
my
if you go
kids weren't
by,
gonna-
you know, if you know something that's moving, you know, they'll get a case of it, bring a
snacks.
case with you.
kids snacks individually wrapped are always needed because we also give that to the policemen and the kids in crisis counselors. So they have food for kids that come in and might be hungry. We do human services. to
No,
kids.
so food.
Yeah.
No
Yeah,
chocolate
yeah,
sticks,
you like those,
No
yeah.
carrot sticks, just
Yeah.
snacks, got it.
This-
Yeah. Doritos.
Doritos.
Cheetos and Doritos.
People live in the want, right?
Everybody thinks with an orange candy.
And an orange tongue, yeah.
Okay, thank you. Next, Human Services Telehealth Program, Jim.
Yes,
And
and
Bethany, I guess.
Jim and Ivan, Jim, take it away.
actually, because we have, I'm gonna make a motion to discontinue it and when I finish. I want to forewarn you that the deck that we have is because we have a lot of new people. In fact, I was thinking Ferguson is the only person who's on it.
Yeah.
Back in 2010, when we started. We'll look at the long-term seniors. Needs of New Canaan, and that was what you got, telehealth and technology. So I'm only gonna talk about page 2, which is the super highlights. But I would encourage you to take a look at what I tried to do is pull out some of the more poignant pieces of what has evolved over the last 12 years. So before we get to the discontinuation, I want to tell you why we started this in the first place.
the genesis actually was the Board of Selectmen asking the commission to provide a look for the next 20 years of what the senior needs in town is going to be back in 2010, and put together a terrific group of people. And a year later, did the first preliminary, 2 years later, the whole thing that became the optimal livable community plan. Interestingly enough, AARP has a national plan called Livable Community. I happened to make a presentation 10 years ago, right after we were seeing some traction in Canada at a state. Convocation, as they call it, people talking about senior needs. And the woman from AARP National who headed the whole national program, was the speaker before me. Everything that she showed as an example of a livable community was what we then showed we were doing, and then we took it to another level with technology and since then, several people have come down from Hartford to visit, and again, the optimal livable community is still a concept that you never totally achieve, but we made some serious steps toward that. And so when we talk about AARP, I'm going to be back there talking about the urgent assessment and telemedicine programs, which we did not yet. I can leap ahead of the agenda. We didn't get either of the AARP grants nationally. There were thousands of grant apps, and they make a big deal up front that they're going to be focused on inner city and very small grants. So we were looking for $50,000 for Silver Hill and 25 for Waverly. And not surprising that we were passed up. Plus, the other thing, as soon as New Canaan showed up on the list, they come to like small, poor towns in upstate Connecticut. And maybe they do get money for the state of Connecticut. Anyway, so the net is that this plan, which has had a lot of pieces to it besides telehealth, we reduced taxes, we put 25 benches out in town and did a whole group of things. The biggest single thing that it did, talking about marketing, was put human services in the forefront of seniors thinking through staying put in the men's club, et cetera, et cetera. And historically, people only came in and testified in this, Bethany, that most of the time people prior to this report came into Vine Cottage when their hair was on fire.
Yeah.
They have a mom that needed to be placed, etc. They had little idea. The health department was inspecting septic tanks, swimming pools, primarily. There was no COVID going on, so it was
I wasn't even here in 2010.
Plain solitaire.
Listen to all the reports you two just made. I mean, this truly is not. Okay, and there is a plan. And we continue to see. The biggest single thing we did was define the value of a senior, because everybody was in love with students and with education, et cetera, et cetera. 23% at the time of the town was seniors. And they are a very high return on investment for this town. That's how we afforded the high education system, among other things. But culturally, politically, et cetera, most of the volunteers over prostitution for all these things from Meals on Wheels. Forget about seniors who have the time. But again, that's changing and boy, the better. And then finally, we were looking for a major differentiation of all these other things that AARP was tracking, and technology was a non sequitur in Washington and Hartford at the time. And basically, at the peak, we had 300 people that were calling in. Bethany was the most popular girl at the senior men's club.
Is that your resume?
We're going We're so proud of that.
Flavor of health and service over the last few years. That's an important thing, and telehealth was part of it. However, having made a living for 30 years in selling innovation to corporations and governments, basically at some point, being the first guy out sometimes has a pro and con. So it is time for us to change from the current system for a variety of reasons. But what did we learn? Well, at the back of the deck that you have is Jim Wilshire's $100 billion savings for Medicare analysis. Which I used in classic consultant fees, a study done by Medicare back in 2012 that tended to look at, should we be spending any money at all on educating seniors or spend all of our money for taxpayers and whatnot in Washington? At the end of the day, we decided not to continue what was a very encouraging set of findings, I thought. And if you triage the senior population by high risk, middle risk, and no risk, it's as we all know, and with the congressional budgets now hot on everybody's list, it's one of the biggest items in the budget. And so we need to figure out how to do some cost reduction. Education and engagement works. And I know that for a variety of reasons. The TIPS project, which I left the commission for 3 years as part of the 4-state operation, which was our program adapted to low-income seniors. And we got a $2 million grant from the Weinberg Foundation, and then the Connecticut was one of the 4 states and ran the Connecticut program out of Stanford. It worked amazingly well. You could reduce, here we were focusing on the first medical application where rather than just pure wellness and exercise thing here in Canada. You could reduce the number of trips to the ER and to rehospitalizations dramatically, 75% in some cases. And we got Mount Sinai to be a major part of the analysis. Depending on what malady you got, diabetes people have a penchant for lots of problems. You could reduce that ER trip 75%. And that was proved beyond a shadow of a doubt with the years of this program. Interestingly enough, even with the fact that, once again, education and engagement would pay dividends, we had a $40 million grant at one point to do 100 units in New York City. It became so onerous in the execution that even Mount Sinai couldn't figure out, and we had to give the money back. That was the last time Medicare looked at what's the value of saving money with wellness instead of spending it on illness. The next thing that shows up that I'll take some credit, not for hiring Russ, but for having suddenly arrive as a very telehealth oriented person. And then I served as a member of the board of long-term planning and made a presentation 2 years ago, or maybe 3, to the board. That was one small piece of laying the track for what Russ has done. Telemedicine is where the action is of the moment. But there's a longer term thing, and we'll talk about it in a minute, but fundamentally, that's going to be something that I think will be with us forever, because the other single thing that COVID produced few benefits as far as I'm concerned, but it gave telehealth technology the credibility that it had lacked. I made 2 presentations to the Kent State group over the years. That was the Department of Commerce, interestingly enough, was promoting telehealth when the Department of Health and Human Services
And CMS and these kind of places wouldn't give it the time of day. Anyway, the net of it is that COVID is with us to stay, it's now professionally acceptable. And quite frankly, one of the reasons that I've been interested in this for a long time, we do not have an option to do anything but more telehealth, I guess, I'd say, because we can't afford the track that we're on healthcare wise. Russ is gonna be a major part of building that evidence eventually, but right now, once again, it feeds back into the optimal livable community for this whole area of the world. Okay, and but what we learned as soon as I left, any wellness program that doesn't have somebody flacking it on a daily basis, wellness is boring. And without some kind of a promotion, we used to send out a monthly newsletter that most people threw on the coffee table and didn't read until they had nothing else to read. And they would, anyway, so you never know what works, what doesn't, but what we do know is that it requires some kind of a consistent message, and somebody has to carry that forward. And the other problem is that in senior life, now that I am a super senior in the Lake Club membership, the problem with seniors is if I'm not sick, I'm well, or vice versa. And so it's very difficult to get seniors trained to shoot ahead of the ducks, as I like to say, in watching their blood pressure. We used to save on the average of one life a year based on this. And that was not our job at all, the telehealth program, but there were people that, one famous cardiologist here in town, said, "Oh, this damn wrist thing doesn't work," and came in to see Bethany to get an arm blood pressure, and he found out that he had prescribed his own medication, which he is forever indebted to us. But anyway, the net of this whole thing is we were trying to solve the problem of inactivity, which is the biggest single problem, which leads to obesity. And if you've been in an airport recently, you see what happens on a global basis and a global and being all demographics. Okay, so and the other thing is that the world has been spoiled. Everybody who's used to corporate health programs or state healthcare programs or whatnot, and so everybody wants it free. That's going to be a challenge. Don't know, but maybe there's a return on investment story to be had there. Okay, so in the future, technology of healthcare or telehealth is part of the woodwork now for the foreseeable future. It has to be. We have no choice. But most importantly, I got to have done this 25 years ago as a consulting client called Telemed. It had a 9 million EKGs and a computer in Chicago. If I'm a doctor in Keokuk and I can't figure out what's wrong with the patient, I would send his EKG in by telephone. Be compared to the 9 million, and the computer would spit out in a matter of seconds what the rank order of probability of what the doctor should be looking for. And that was overread by 3 cardiologists on the University of Chicago Medical School. So now you had a guy in Keokuk as smart as the people in Chicago, as it were. The biggest single thing that caught my eye was you could forecast heart attacks off of this, that humanly impossible. So one of the things that I continue to preach on wellness is that it's the best health is staying not sick, basically. And the way you do that is by know thyself, as it were. Okay. The Healthy Mind and Body is produced that show with Silver Hill 3 years ago at the beginning of COVID. They are joined, and you can't have one without the other. And far more technology these days is still being spent on healing people and more pills and more cutting and pasting, as it were, which is how I think of the surgeons. But realistically, we're just now beginning to get
the money into wellness that is needed. But it's not gonna be easy and it's gonna take a while, and that's why we're sort of out of time for a little wide spot in road called New Canaan to continue a telehealth program. And with that, I make the motion to discontinue the telehealth program as it currently exists. To have Harrison, Bethany send out a note to the people that are still active, which is only 15 or 20 at this stage of the game. Whether or not we offer them the opportunity to join the Wayland program is something we're going to discuss with Russ and Ruth. But basically, yours is the telemed program, this is telehealth, which is wellness tracking. So, my motion is that we discontinue the telehealth program until future time, because there's all kinds of opportunities. Gerber uses telehealth for his outpatients. There is a section of the Ruston program that is telepsych. So there's immediate. I don't think the market is ready for this quite yet.
I'm sorry.
But,
Thought I turned it off.
but there's an opportunity in here kicking around somewhere. I'm just not sure where. So I don't
this
think
is second, what Bethany's perspective is, that it just becomes somewhat obsolete in town.
well, it's yeah.
Maybe that's
it's not
where it
really-
is too, is where it works.
Can I just add, though, that Bethany did a phenomenal job. I mean, you had 200 or something at the beginning, I think.
300.
300, and you managed all that and on top of everything else. And I've been in your office where you get emails from somebody sending you their data and you're writing right back. And, you know, for the time, it was a huge benefit to everybody. And it's good to know that it's being transitioned somewhere else, but you deserve a lot of
Yeah, and it was
credit.
very helpful for human services for being known, not just for federal and state programs. It was also for wellness, and you didn't.
For everybody.
It was across the spectrum in terms of wellness and demographics. So, yeah, very, very positive. I've enjoyed forming relationships, and very often they've come back in for other things as they've aged. This has been going on since 2012. I started in 2013, so almost 10 years, and wonderful. At the same time, as everybody, not a lot of people have their watches on, the ability of the dashboard, just taking pulse, blood pressure and weight, is just in order to ramp it up to this level, to the money, it's just not there.
That's what
And the staff, it's just the money isn't there to continue it or be competitive. What's out there?
Just for the record, we do 100 telemedicines a day. I'll take 40,000 or 40 million. Sorry.
You think you can
But
figure it
so
out?
I figured we figured out how to do it.
Well, there's a pony in there somewhere, and again, it's timing of anything innovative in the marketplace, particularly healthcare, and particularly with seniors, is always a challenge.
Yeah, well, as we know, because they're not so tech savvy.
Okay.
The letter will go out. I
Okay,
think we have to move on now.
Yeah,
Do we need to approve that motion?
Yeah.
we need a second.
Second,
Okay.
all in favor?
And I have to read stuff
Yes.
for the record.
Okay.
Yeah, I mean, before we leave.
Hi, Alicia. Okay, we know you're there, Liz.
I think we just refer them to their position of primary care providers. Bethany, for direction going forward, probably they, both of them, I'm gonna put them on.
I will send a letter out. I will put you all on it so you can see what the closing letter will be. I'll work with Harrison on it. You're okay with that?
Yes,
Okay.
Thank you for doing that for 10 years.
yeah.
Thank you.
Loved it, yeah.
Went fast, huh?
The history and the motion, now, new business executive stress, so Russ announced last weekend that he has attended a function in Greenwich with Dr. Gerber about executive stress, et cetera. So, you know, what's happened to Darien, over the last few years with that mid-level age grouping, is a concern. And, I think what Darrell mentioned today about Darien with their teams and the suicide walk, et cetera, to awareness and realize that if you're not okay, you're okay, and to seek help appropriately, et cetera. And, you know, I think this is something that we should look at, and let's just hear not to.
Yeah, in the very interest of time, I'm just gonna say it. So May 3rd, you have some flyers, and you also have a book in the program. Silver Hill did a program all day in Greenwich on executive stress and burnout for type A personalities and for overachievers. Had over 100 people who attended. God knows we do not have any overachievers or type A personalities in New Canaan. So it was not.
Or this group, yeah.
I was intrigued with the title, Managing Your Success Addiction. Think about that, managing your success addiction.
Right, you get endorphin release.
Yes, and as a commissioner, we brought attention to child stress issues exacerbated by COVID and social media, vaping going up, the elderly with isolation and self-medicating and over-medicating. But recently we're starting to see upticks in suicidal ideations with, it's highly publicized as well for executives, men, women, all executives. So managing your success addiction was something that I think would be, we'd like to go to Silver Hill and ask them to do something like that in New Canaan. And again, I wanna give justice to it, but quickly go through it given our time constraints. It's a vicious negative cycle. Success addiction becomes successful by working more than others. They believe they have to keep up the pace to maintain their astronomical productivity. The initial positive rewards of productivity give way to fear of failing. Soon enough, work crowds out relationships and outside activities, with everything else, work is all that is left, which reinforces the cycle. What I was also intrigued about is overworking from home. Right, that when you go to work and you get in your car, you have downtime. When you leave work, you have an opportunity to listen to music, to do other things. When you're working from home, it is constantly going, and you're constantly going, oh, let me get back into my office computer. So these are things I think that our community, maybe even some of us around the table, I'll raise my hand, going through COVID and everything else that's going on in our business lines, it is something I think we could draw attention to, and having a program to have executives come in, I think it's an opportunity to talk about children as well, and to look at as the executives as a means of fundraising for some of these activities and programs. So I have a lot more to say on it, but in the interest of time,
Thank you.
Mr. Mayor, and I did hand out the Steward House program that Silverville currently has. I gave to the chairman who can circulate it in one of the book that was there, as well as the full material and stuff. I wanted to be succinct.
Can I want to put that into slightly bigger context? Because one of the really interesting things that's come out of this collective has been the different mental health challenges for different age groups and cohorts. And I even mentioned this at the foundation thing yesterday, and everybody's ears really pricked up to start to understand that a little bit more specifically, so that as we try to improve health across everything, it's not one thing. I mean, Jim, you were super articulate. That was what really set the light bulb off on the mindset of seniors. And now, Russ, you're coming in with this, like the hardcore sort of executives and the kids and all that.
And it's a
Everything.
crossover, right? And that's how we talk about the challenges for kids with social media, that bullying doesn't stop at the end of the school day, it falls into one class through social media. I mean, it all kind of has a commonality that we don't have these natural breaks anymore, you know, which exacerbates existing problems.
But I think it could be a really interesting work stream that would kind of create, you know, a graphic or something to find the different communities, right? And the major issues in each. And then I think we could provide a real service so that all the providers out there can start to say, oh gosh, it's not one size fits all at all. And we're in a unique position to do something like over time. This is not an overnight kind of thing, but I think but again, this is what's come out of this group, everybody contributing individually, and I think we get out a lot of value by just taking a stab at segmenting almost.
Yeah, I think we can move forward. I appreciate what you bring here. There's the 4 reps and even the high school kids with the games and awareness, looking at that age group. I'll speak to Jay Egan, athletic director of the high school, and see what, more about the area and what we can do if we can. We're at the end of the year now in terms of that, but going forward and addressing this success addiction thing, I think we're all
Yes.
victimized to an extent. I mean, it is part of progress
love the
of living and life challenges and competition, and this is the way it is. But yeah, I think that's overdone with a lot of us. I had flashbacks to, maybe living in Europe, they don't have this edge, but it's
Yeah.
here. And I think
And it
we have
starts
to
in
look
the
at that, and with these tragedies that we witnessed in New Canaan and Darien over the last couple of years, if we can do anything to not only diminish that, but also improve the lives and the mental health, as we say, of the groupings, all the age groupings. I think it's a calling to see what we can do with this.
It's a really good way to look at it.
No one says.
Yeah, fascinating.
Okay. Motion to adjourn, please. Thank you.
Second.
Thanks, everybody.
Thank-
Okay, I'm gonna stop.
Bye, Jen.